Great, thank you, and good afternoon from where I am. Thank you for inviting me to speak today, and it's a pleasure to support the Kingdom of Saudi Arabia at this conference, and especially in the year of the Kingdom's G20 presidency. I represent NHS Digital, who's been supporting the Kingdom for the last 2 years, providing strategic advice to support the implementation of the Kingdom's Vision 2030 digital health strategy. And if you can see from my sling, I fell off my bicycle and broke my clavicle just last Thursday when I was out cycling with my son. So if you see me wince during the presentation, you'll know why. So I'm covering NHS Digital's response to COVID, open data, and how we've used open data as part of that, and really importantly, protecting citizens' data rights. Because protecting citizens' data rights is something which we are especially strident about at NHS Digital. So even during the pandemic, even through the pandemic, our mandate to operate as an organisation, although is enshrined within UK law, it really comes, and that mandate really comes from the trust which citizens bestow on us and how we carefully use the data about their care. I'll kick off by talking very briefly about the NHS Longterm Plan. So in 2018, just a couple of years ago, the taxpayer-funded National Health Service, which we have in the UK, marked its 70th anniversary. And during that anniversary, there was lots of debate about the NHS. And I think if you distill that debate down, there were three key truths. That there's a lot of pride in the NHS and its enduring success, which was set up just after World War II, and in the shared social commitment it represents. There was concern about how it be funded, staffed, the increasing health inequalities and pressures from a growing and ageing population. But there was also optimism about the possibilities of continuing medical advances and better outcomes for care. So looking ahead to the NHS's 80th birthday, the NHS Long-Term Plan took those three realities as its starting point and tried to take forward what was good about the NHS and its place in the UK's national life, but tackling the pressures and issues it faces head on. And to do that, the NHS Long-Term Plan outlined how the redesign of patient care should be accelerated to future-proof the NHS for the decade ahead. And the plan sets out how it would do that, and its focus was doing the 5 things you see on the screen here around a new service model with more control for the patient and fully integrated health and social care at a local level, better prevention, driving less inequality, more recruitment of staff to fill the vacancies which I had in the NHS and create a better working environment for those staff, improved use of data and digital technologies, and ultimately delivering better value for the taxpayer-funded system. So it was launched in January 2019, and although its themes are still very, very relevant today, and it's the direction of travel and the framework for the NHS in England, it didn't foresee a pandemic, and it didn't mention emergent viruses. So very quickly, NHS Digital. So we are the data and technology partner of the NHS in England. Our job is to make health and care better, and that's why I get out of bed in the morning. And we work across both health and adult social care. And I've included the World Health Organization logo here. It's due to our work on international classifications and terminologies such as ICD-10 and 11. We're a WHO designated organization, so we can use their logo where appropriate for a 3-year period. We operate in England because health is a devolved issue in the United Kingdom, with Scotland, Wales and Northern Ireland each having their own approaches to meet their own local priorities for health under their devolved governments. And we are taxpayer funded, mainly by our Department of Health and Social Care, and we employ about 2,500 people and spend about £420 million worth of taxpayers' money each year, and we deliver an awful lot. And in terms of what we deliver, We deliver the critical health digital infrastructure for the NHS in England, and that infrastructure is used every second of every day in the NHS. And whether that's the data fibre network, which the messages pass over, the NHS email service, which is the largest exchange service, Microsoft Exchange service in the world, the NHS data spine, which sends more messages than the UK credit card system, our role in cybersecurity, our role in clinical terminologies and standards, the fact that we're supporting the NHS migrate to cloud and open data and open platform capabilities. And we run many of the national applications, such as the National E-Prescribing and e-referral and the National NHS app. But most importantly, we manage the most important and sensitive health and care data sets in terms of hospital, inpatient, outpatient and emergency care and outcomes, mental health data, community data and GP record data down at an individual record and patient level. And we manage that so we can provide more powerful and meaningful analytics and act as a platform enabling the rest of the health and care system. But we don't do that alone. We do it in partnership with many bodies, with Public Health England, who led the response to the pandemic, with the new Test and Trace organisation, with NHSX, with local NHS and social care organisations, the innovative technology market in the UK and beyond, some of the eminent universities which exist in England, the care professionals, but most importantly, the patients and those who we serve and bestow their trust upon us. So that is who we are as NHS Digital, so hopefully you've got a good feel. In terms of how we responded to COVID, we worked in partnership to respond in 6 main ways. We improved and updated citizen channels. So we run the NHS website, which is the most popular health website in Europe. And we updated all the content. We ran some social media campaigns, and we provided clinically assured content to 300 other micro websites which could use that. And we provided a online symptom checker for the 111 online service. And just putting that live, and it was announced in a Prime Ministerial speech, showed a 90% channel shift from citizens calling 111, the non-urgent call number, to try and get a diagnosis, to then switching to use the online tool. And that 90% channel shift happened instantly. We enabled remote and collaborative care by providing access for clinicians to citizens' shared records, and we busily uploaded and we used the pandemic as a driver to upload 97% of citizens' records in a summary record, so their long-term conditions, medication care are available at their point of care. And we delivered the underlying technology to support the antigen testing service, and we deployed digital infrastructure to help out of hospital antibody testing. But we didn't do the UK tracing app. I'll talk about the 2 green things in a moment, because that's what my presentation's about. And we did enable research and clinical trials. So through our NHS Digitrials unit, we provided identifiable data into the 12,000 patients who've been recruited into the world-famous recovery trial. And this is a randomized controlled trial which identified that the malaria drug, hydroxychloroquine, which Donald Trump mentioned a lot, has no impact on those in intensive care with COVID-19. But actually dexamethasone, a very low-cost steroid drug, does, and saves about 1 in 5 lives of those who are in acute care, in intensive care, and on oxygen. So, and that discovery by the recovery trial meant that both UK prescribing practice was changed the following day, and the World Health Organization changed its prescribing guidelines within a week. And also on the research side, we've delivered a tool which citizens can use in the UK to sign up to be contacted to participate in a COVID vaccine trial, which we're busy mobilising and investing in as a country. So this is how we supported the NHS to respond to COVID-19. And if you wish, you can find more detail by just following the public link there, which has our gold reports of what we've achieved over the last 4 weeks. Now, in terms of open data, and before I talk specifically about COVID-19 open data, a UK reference on open data is the Open Data Institute, which we work very closely with, and we input to their work and vice versa. And it's worth saying that they do have a much wider brief than health. They have a brief across all industries. But founded in 2012, the ODI is an international not-profit organisation based in London. I work on a day-to-day basis with Jenny Tennyson, their chief exec. Sir Nigel Shadbolt is their chairman, and Sir Nigel is one of the UK's most foremost computer scientists at the University of Oxford. And in 2009, the then Prime Minister Gordon Brown appointed both Sir Nigel and Sir Tim Berners-Lee to lead a review of access to public sector information, which they did, and that led to the highly acclaimed data.gov.uk website that now provides a portal to tens of thousands of mainly non-health open data sets. And you'll no doubt be familiar with Sir Tim Berners-Lee, one of the founders of the founding fathers of the internet. So the ODI has a great mission, a great vision and mission, which are worth dwelling on. In terms of the vision, the ODI want a world where data works for everyone, which is absolutely great. But if you unpick data works for everyone, that means does useful and valuable work, and also works for everyone means meets the needs, requirements, and concerns of. So in terms of open data, it must be valuable, but also meet the requirements and concerns of individuals. And also their mission talks about a trustworthy data ecosystem. And trustworthy means both accurate and reliable, but also a system which is worthy of trust by the public. So I think the vision and mission of the ODI are brilliant and very relevant, but it's really worth picking out data that works for everyone and trustworthiness as part of open data. So then if we narrow down to the NHS in England, so we've got a goal that open data is data that's available to everyone, open access, and for those to use and share with three main goals: to improve health and social care, as is the role of our organisation, to inform public debate, and I think to gain trust from the public, you need to inform them. And through our open data, we can inform the dialogue and the public debate on use of data. And it's been great to see citizen epidemiologists during the COVID period really understanding the data and becoming experts in health data, which maybe we wouldn't have expected, certainly back in January and February in the UK. And being able to provide that data and explain it is an absolute key part of our role, and as is speaking truth to power and making sure that the data is seen and heard by those in elected office and in government. And also our role is to support the innovation and to help develop the UK economy in open data. And so we have about 140 open data releases a year, often tagged to our statistical national statistics or experimental statistics. But during COVID, it's really driven kind of four main types of open data. And this is a public website. You can find our dashboard hub there at the URL at the bottom of the screen. And the four dashboards really produced was the progression dashboard, top left, the coronavirus shielded patient list, bottom left, and I'll be talking about those two in a bit more detail. The NHS Pathways Coronavirus Triage dashboard, and an e-referral dashboard where you can see how the referring rates of family physicians into acute care has dramatically changed pre, during and post the COVID period. So those are the four key dashboards we've produced. I was hoping to do a bit of a live demo, but we didn't think we could quite get the technology to work. So unfortunately, I'll be doing a slide walkthrough, but hopefully you'll be able to pick up the key points. So in terms of the progression dashboard, and it looks really busy, so I'll explain what it is, and then I'll delve into the details a bit more. So I think the dashboard is really cool. It takes the outcomes of those people who've called 999, urgent care number, 111, non-urgent care number, or for those who've gone onto 111 online and ended up with a disposition or an outcome of COVID. But it also considers those who've had a positive lab or commercial swab test result. And the data is very fresh. It's only 3 days in arrears. And the reason we have it 3 days in arrears is we find the first two days is very noisy. So having it 3 days in arrears helps that smooth out. And the data is updated daily. So this is an asset, which is a Tableau visualization. And Tableau sits on our Amazon Web Services, Databricks, data processing platform, data services. So it's pretty cool that we can push out data to the nation, to the public. So this isn't a private dashboard or one just for NHS staff or for directors of public health, which goes out to the public on a daily basis, really detailing the status of COVID around England. And it shows a national position, and you can drill down into local NHS commissioning areas or local government boundaries as well. So if I just kind of talk us through it, at the top here you can see in the last 7-day rolling period, and the date is accurate as up to the 7th of August. I did the screen grabs a couple of days ago, so that's why it's slightly later than 3 days in arrears. And you can see that in that 7-day period, more than 3 days in arrears, in the 7-day period, you can see we had 20,000 citizens went on 111 online, just under 9,000 calling 111 or 999, giving 29,000 people had a disposition, and there were 4,600 positive tests through either lab tests or commercial swab tests. And you can see in that rather busy diagram, which looks like a smoke cloud, and the smoke is the history of each of the 9 regions of England. And you can go, the darker blobs are where their current situation is. And you can see very clearly there's an outlier, isn't there, right on the right-hand side there. And that's Leicester, which is the city of Leicester, which is in the East Midlands of England, which has had a lot of focus on being a coronavirus hotspot, and mobile testing vans were deployed, and a local lockdown was put in place. So this is the data from Leicester as of the 7th of August. And then just to the right of the diagram of the fade, you can see Leicester at the top, but also the other regions of England and the other local authorities in England, which have the highest number of citizens calling 999 111 or going on 111 online with the disposition of COVID. On the right-hand side there, you can, in the orange blobs, you can see the positive test results. Obviously very high in Leicester because you surged testing capacity into Leicester, but you can see what the test result was per, I think, 1,000 of the population for the other cities as well. Not surprisingly, those local authorities, a lot of them in the north of England, a lot of them are ex-industrial areas where the housing's more close together, and that really helps the local directors of public health really focus their assets in intervening where they need to on a national basis. And we provide a more granular version of this to local authority directors of public health, and they have 2-factor authentication, and they can look down to an individual postcode level to respond, and citizens can go and see what's happening in their area. And what I've done on the next slide here is just pull out both London and the East Midlands, and again you can still see Leicester prominent there. And now I'm going to move on to the second of the 2 dashboards I'm going to talk about, which is the shielded patient list. So the shielded list, and I'm just checking I'm not overrunning, the shielded list was a request by the Chief Medical Officer to provide a way of advising a subset of the population, those who are clinically extremely vulnerable, to be able to shield. And those who shielded were those who've had solid organ transplants, with specific cancers, with severe respiratory conditions, rare diseases, were undergoing immunosuppressant therapies, and those who are pregnant, for example. And the data was the shielded list was created from routinely collected national data initially to create the shielded list. And that list had originally about 1 million citizens on it as at late March when it was first created. And over time, we enabled family physicians or GP practices to add to it, hospitals and other organisations to add to it. And as it stood at its 19th release, so we've got through 19 releases, it had approximately 2.2 million citizens on it. And the government used that shielded list to write to the citizens to ask them to stay at home, to limit social contact and to receive food deliveries. And the government also used that shielded list to provide local councils, so the local councils could provide more targeted services like food programmes and enable supermarkets to offer priority food slots to those shielding. And there was an inherently a massive interest in shielding because it had a profound impact on over 2 million citizens' lives. So we had to be very, very transparent in our approach. And we published the risk criteria, we published the algorithm, we published the timing and the known issues with the shielding list. We published guidance for general practice for hospitals, for other organisations, as well as a transparency notice under GDPR. And all of that was about building trust with citizens in the efficacy of the shielded list, and that helped it land more appropriately in the system, enabled citizens to have trust in what we and government were doing, But through that, we found that there was a very big demand for open data relating to shielding, whether it's the emerging vaccine clinical trials wanted to know where they should consider targeting their resources from other researchers, from the media and citizens. So we responded to the demand by creating this, which you see in front of you, which is the shielded patient list open data set. This is the website, very careful at the front. If you're a patient, please use the NHS website to get your advice. Or if you're already on the list and you've got questions, please go to the government website where you can get extra support. But if you scroll down the list, scroll down the web page, you can see that there's a map of England showing each of the NHS commissioning areas and the percentage shielding by region. And at the top with those two blue bars, you can see the split by age and by gender. And you can see of the 55,977,000 citizens to 2,230,000 were shielding, which is just under 4% of the population. We were very, very clear on what the shielding list does include and what it excludes and what it doesn't include. And again, being very clear and transparent around that is that's important to build confidence in those who are using the asset. And just finally, in this, just drilling down to one area, which is the northwest of England, which has a lot of local lockdowns happening at the moment. And you can see the most darkest blue area, and that's actually Liverpool commissioning group with a bit of water just to the left of that being the Mersey. And so Liverpool, a very old industrial area, an up and coming city now, but that had one of the highest lists of those citizens shielding in England. So I'll just move on very quickly. I'm conscious of time. I think I've just got a couple more minutes left. That the way we protected citizens' data rights was enshrined within the UK law, which is critical during the pandemic. We didn't let standards slip. We absolutely followed the letter and the intent of the law. So by the 17th of March, we at NHS Digital had a full legal framework to work within. So we had some public health directions, and also use the control of patient information notice, which required us to share data for purposes of urgent public health and for dealing with communicable diseases. So we had the right legal framework, and both of those stemmed from either previous acts of government or previous regulations, which we could draw down on. And also, we were dealing with, when we were working with our devolved nations of Scotland, Wales, and Northern Ireland. So we had some Section 255 requests from each of those. So I had a legal framework to work with each of our home countries as well. But my final slide is about protecting citizens' data rights and how, from the outset, we needed to ensure that we maintained an absolute rigorous approach to protecting citizens' data rights. As maintaining and preserving public and patient trust is critical to sharing data during the pandemic and after the pandemic for vital care, for monitoring, for surveillance, for planning and research purposes. And we're very lucky in holding such a valuable national asset in the health and care data. And our ability to use that appropriately has been key in the system-wide response. So specifically, we rigorously worked within our directions and our the COPE framework to be solution-focused and operate at pace. We did that while making sure that the appropriate safeguards in place with data accuracy, making sure the data was as accurate as it could be. It was minimised, and that minimisation was necessary and proportional. And we take the cybersecurity of the data, given the heightened risk profile during COVID, we absolutely really made sure that cybersecurity and data security was at the front end of our minds. Whenever we published data, we did a data privacy impact assessment, which weighed up the risks of releasing the data versus not. We ran fast track approvals, and we were very, very transparent in what we did, both on the new data we collected, the analysis we conducted, and the disseminations and the publications we made. On the new collections, we published a unified register, which is available for public members of the public to go and view. And in terms of what we released, again, we have a monthly register which citizens can go and view and see exactly who we released the data for, on what legal basis, and the type of data we released. And we did this by communicating also with some of our key partners, with the National Data Guardian for health and social care, which is an individual who has a statutory footing to ensure that data is used appropriately in the NHS in England, with Information Commissioner, and the Understanding Patient Data information asset, which is a great facility funded by the Wellcome Trust. And you can Google Understanding Patient Data, and it's a really great resource of the language of using citizens' data in the language that citizens understand, with case studies, or to help build some capabilities to improve better communication of use of patients' data. So this overview I've given you hasn't been about gathering data in, gathering open data and giving it to commercial AI partners or Cambridge Analytica or large foreign companies. It's been about careful and speedy use of that data in NHS data stores, building trust openly and within a clear legal framework. So just to conclude my presentation, we published key open data to support citizens, the media and others understand the response to the pandemic, and so they could respond to the pandemic. I think we did that thoughtfully and quickly within our legal framework. And if I just have one message, and it's about having an open and democratic conversation and a partnership with the public and with individuals as to the value and uses of data about their care, and that standards can be maintained even during a pandemic. So thank you very much for listening, and I look forward to working with my colleagues to take any questions. Thank you.